here at Aspenwood Veterinary Hospital, and some of you have sent in some questions for our doctors. You can do that at the Faithful Friends website or the Faithful Friends Facebook page, and those are forwarded to our doctors. Some of them have a little bit more extensive answers that need to be given, so we won't be able to answer those due to video time that we have, but if there's some that we can answer in a little bit more concise, we're going to go ahead and cover those for you, like two of the questions that we have today. We had an individual who wrote in and asked about arthritic changes in their canine patient. Dr. Levengood had a chance to answer these questions for us, and he talked about a couple different things that you can do. Maintaining a good body weight. Any type of excess weight is going to put extra strain on those joints, so just like people, we want to try to maintain a nice healthy body weight. Getting plenty of exercise, daily exercise, 10 to 20 minutes is definitely recommended. For young patients who aren't exhibiting a lot of changes at this point, you can buy some over-the-counter supplements that are really great for joint health. There's glucosamine chondroitins. Soy and avocado extract has been a good one as well. Fish oil is really good. You can get some supplements that you can pump right onto the food there that they can eat for you. And if you're starting to see changes that are a little bit more extreme at this point, a little bit of difficulty getting up, reluctance to do stairs, you definitely want to contact your veterinarian. There can be some anti-inflammatory medications that are perfectly safe for pets that can be utilized to keep them a little bit more comfortable. Our second question came in asking about managing a feline weight at home. It looks like they have a kitty that's a little bit fluffier than they were hoping for. All animals need to have calories maintained at a good weight, just like we do. So checking how much caloric intake your animals are receiving is always important. Feeding them maybe once or twice a day, as opposed to free feed, where the food is just out and available for them. It allows them to overeat a little bit. Keeping tabs on that. Also exercise. Cats that are indoors don't get as much exercise as they might if they were outside. So using things like laser pointers, toys with them, enticing them to play, great idea to do at home. Also a great thing to do just to interact with them. And then if you are seeing issues, one of the things you need to keep in mind is sometimes there's an underlying medical concern. So if you're doing all those things, cutting back on food, making sure they're not getting a lot of treats, making sure they're exercising, and you're still not seeing much change, you may want to look into having some diagnostic blood work run. Sometimes there's underlying issues like thyroid changes that can definitely prevent them from being able to lose weight like we would like to see. So again, contact your veterinarian if you have any issues or concerns, and maybe further that with them and see what they think as far as moving forward with some testing. It's December, and here we are on the holidays, and most of us have trees at home, maybe gift packages sitting around, and we're going to be doing some baking and some cooking. So obviously we want to keep in mind how to keep our pets safe at home. Things to keep in mind, some of the treats that we have, definitely something you want to keep away from them. Nuts can be a high toxicity level for animals. Xylitol, which is a sweetener that's found in a lot of commercial products, we may not think about that, but that has a high toxicity level. Grapes, raisins, some of those things that chocolate, we typically eat and keep around. The ASPCA actually has a wonderful website up that posts a lot of those things that you might not think about if you want to take a look at that just to keep our animals safe. Daily or plants, decorative plants that we have around the holidays. Poinsettias come to mind. A lot of people have poinsettias. Those are definitely something you want to keep away from the animals. Christmas lights. Kittens and puppies love Christmas lights, and they will bite down on them, and you can cause an electrocution issue. You can also cause minor burns in the mouth. Packaging, anything with strings, anything with ribbon, always enticing. They always want to play with that. Those can cause what's considered a linear foreign body, which actually causes issues in the GI tract and can end up leading to a surgical repair. So, we want to keep them safe from anything from diarrhea and vomiting that they can have to much more severe cases that they can run into. And if you have an issue, you think they may have ingested something, you think they may have gotten into a broken ornament, anything like that, there's always emergency facilities that are available 24 hours a day, or call your regular veterinarian and touch base with them. We're always happy to answer questions for you over the phone and let you know if we need to have you bring them right in. And we hope that it helps everybody have a safe and happy holiday. Most of you have dropped your pets off with us or your regular veterinary clinic before for anesthetic procedures. having to say goodbye at the door and leave them with us. And we do try to go over with you what it is that we do during those procedures, but I know it's a little bit hard if you're not in veterinary care or somewhere in the medical field. So today our behind the scenes is just kind of giving you an idea of what those things are that we talk about with you at the time of drop off on those consent forms, so you have a little bit better understanding of what's actually going on with your pet when they're back here spending the day with us. So when we're moving into an anesthetic procedure, they do initially receive pre-anesthetic injections. That's for pain relief and also a slight sedative. It also allows us to use a little bit less gas anesthesia. This is going to be an example of our anesthesia machine. It's isoflurane and also oxygen, so we can help regulate how deep they're under as far as the sedation level during the procedure itself. We have an IV fluid pump, several different options, but this happens to be the one we have here today. We provide IV fluids during all of our anesthetic procedures through an IV catheter line that's placed in a front leg. We can utilize that to help regulate their blood pressure, help keep their body temperature up by providing warm fluids as well, very similar to things that you would have if you were under anesthesia at a human hospital. We use a Doppler, which is going to help us keep track of their blood pressure. If anybody has ever taken their own blood pressure after exercising, it's the same idea. That's the same location that we place the sensor on, and that gives us an audible play of being able to actually hear that whooshing sound that you hear. So that's something that we can hear even when we're doing other things. We use a blood pressure cuff, just like you'd have at your doctor's office. We're going to check that at least every 5 minutes during the procedure, making sure that their blood pressure is at a normal, looking for trends, changes of decrease or increase of blood pressure where the doctor might feel that we need to do something further. We also have a pulse oximeter, which is going to show us oxygen saturation and also going to show us a number associated with that heart rate. So along with all of these things, we're also checking them just on our own manually every 5 minutes. It's more important to actually check the patient versus check your monitoring equipment. But these are just some extra safety measures that we consider a standard of care that you really need to meet, and it's some of the things that we provide for your pet whenever we have them here under anesthesia. And hopefully with you seeing this, it gives you a little bit better idea and you might feel a little bit safer about dropping them off with us for the day.